Hello learners, welcome to this session on your program Certificate in Fashion Design. I, Dr. Divya Ojha, Academic Associate from School of Vocational Education and Training, Ignou, welcomes you all. So learners, today's topic of discussion is Basics of Pattern Making and Sewing. That is one of the course of this particular program, Certificate in Fashion Design, that is CFDE. We hope that you have gone through the study material and you are aware about this particular course, BFDI 072 Basics of Pattern Making and Sewing. So as you know, this particular program, Certificate in Fashion Design, it is a 16 credit program and it comprises of 4 courses. So 4 courses, that course 1 is about fundamentals of fashion design. Course 2 is about basics of pattern making and sewing, on which we will be discussing today. Course 3 is about introduction to fashion industry, and course 4 is about communication and entrepreneurship. So today we will be focusing on the course 2, that is basics of pattern making and sewing. So in this particular course 2, that is basics of pattern making and sewing, it is a 4 credit course in which 2 credit is for the theory and 2 credit is for practical. So as this is the main course of your program Certificate in Fashion Design, 2 credit is given to the practical, as you will be doing the hands-on and you will be developing the samples, that how of different samples of stitches and the garments. That's why 2 credit is given for the practical. So let us see in brief what this particular course basics of pattern making and sewing is. So in this particular course you have to study 2 blocks and 1 practical workbook is there. Block 1 is about introduction to pattern making. Block 2 is about sewing techniques, and then there is a practical workbook which is based on both the blocks which you have studied and all the units which you will be studying in these 2 blocks. So block 1, when you see, that is introduction to pattern making, it comprises of 4 units. So unit 1 is methods of pattern making, unit 2 is tools of pattern making, unit 3 is body measurements, and unit 4 is about pattern information and marking. So in our last session we have discussed first 2 units of this particular block, that is methods of pattern making and the tools for pattern making. In this session we will discuss the block 3, body measurement and pattern information and markings. So let us start with the unit 3, that is body measurement. So this unit will help you to understand not only the techniques or on the importance of taking the body measurement, but also you will learn about the guidelines and the procedures for taking the important body measurements and how correctly the body measurement you will be taking, that you will learn in this particular unit. And also you will learn about the size chart and the different using of that particular size chart. So with that objective, the main learning outcome of this particular unit is that you will be able to state and explain the importance of measurement taking. You will list and describe the guidelines for measurement taking, and you will identify the body landmarks, that different body landmarks are there which you will be studying and you have to learn while you take the body measurement. And lastly, you will be able to demonstrate the body measurement using style and measuring tape. So these are the main learning objective of this particular unit, on basis of which you have to study this particular unit. So first of all, understand what is body measurement and why it is important. So when you learn to develop a garment or construct a garment, the first thing that you have to understand and learn is to take the body measurement, because without having a good measurement of the body, we cannot create a good fitted garment. So it is very technical thing to understand. So measurements are very important element, as the fit of any garment depends upon the pattern which we used, and which in turns are dependent upon the measurement what we take. So if we are not able to understand how many landmarks are there and how we will take the body measurement, we cannot create the good pattern. And if the pattern which we have made, it will not give a proper fit to the garment. So pattern we have already studied in the unit 1, that it is the basic template on which we use to create the garment. So before developing the garment, we create the pattern, and before developing the pattern, we need the measurements. So it is very important to take the measurement very wisely. Measurement taking is a scientific art that should be done with great accuracy and should be double checked. So if you are taking the measurement, you should at least check, or you should be very conscious when you are taking the measurement. You have to keep all the landmarks in your mind when you are taking the measurement, and all the procedures and the guideline which we will study, you have to follow that. Now let us see what are different guidelines for taking the body measurement. So first important thing, or the first important guideline while you are taking a body measurement, is the person should wear close fitting garments, as the loose fitted garment will not help you identify the body landmarks and will lead to incorrect measurements. Like suppose if you have a good experience of taking body measurement, you will understand this point very correctly, that if the person for whom you are going to take a measurement for constructing a garment, if he or she is wearing a very loose fitting garment and you are taking a measurement, you will not find the appropriate measurement when you are taking. So it is advisable that if for the person for whom you are going to take the measurement, they should wear a close fitting garment, so that the measurement you take, it will be very accurate. The second guideline is the person should stand straight with the feet placed together, as the wrong posture can give incorrect measurement. So it is advisable that for whom you are taking the measurement, they should stand straight with their feet together, as if they are not standing straight or any another posture, the measurement will not be accurate what measurement if you are taking. Then third point is take all the measurements closely but not too tight. Like sometimes we feel that if we take the measurement very close to the body, we will have a good fitted garment, but it is not correct. So it is said that take all the measurement closely but not too tight. And all the girth measurement means the circumference or the round measurement of the body, should be taken with a finger ease between the tape and the body. Suppose you are taking a measurement of the waist, so if the measuring tape which you have put around your waist of the person, there should be a finger ease between the body and the tape which you have taken. Then next is, it is best to take the measurement with a mirror at the back. So why it is said that you should keep a mirror at the back? Because we have certain points or the landmarks on the body, and so you are taking the measurement, and to whom you are taking a measurement, the person is standing in front of you, and you have taken the measuring tape from the back side, and you cannot see you are not able to see that the measuring tape, it is at the proper position of or it is turned around. So it is better to keep a mirror to have the back view of the person or the tape which is you have kept around to get the accurate measurement. So this will ensure that all the measurement you are taking or the measuring tape, it is parallel to the floor or it is at the accurate position on the body. Also ensure that while taking the vertical measurements, the tape is perpendicular to the floor. When you are taking the vertical measurement, the length measurement, the tape or the measuring tape which you are using, it should be perpendicular to the floor. Next is we should use a good quality tape with the measuring tape which you are using. It should be of good quality. It should neither stretch or not should be very stiff. If the tape you are using, it is very stiff, so if you take the measurement, you will not get the accurate measurement, and or you will have the measurement one minus according to the measurement which you want. So you should have the good quality tape, and if the tape is very stretchable, it will also not give you the correct measurement. Next is do not let the person look down at the measurement being taken. So ask the person to stand straight and look forward. They should not look downward or to the measurement which is taken. Next is do not add any ease or extra margin to the measurement taken. Ease can add while drafting the pattern. So when you are taking the measurement, please note down the measurement which is coming. Like suppose you are taking a measurement, it is coming around 30 or 32 or 34. You should write that measurement and do not add any extra margin or any extra number to that. We have to add the extra margin or the numbers when we are creating the pattern or when we are developing the pattern. We add the extra ease at that time, not at the time of taking the measurement. Lastly, it is best to follow the sequence and note down all the measurement. So when you are taking the measurement, it is better to follow the sequence. There are certain sequence that we will discuss in later slide, that we have to follow that sequence, and it is better to start taking the measurement in that sequence only and write all the measurement very correctly and the measurement which you have taken. Then there are certain process of taking the measurement. Now right now we discuss the different guidelines what we have to follow while taking the measurement. Then there are different process of taking measurement that we right now said that we have to follow the process or the sequence. So there are certain sequence that in the first step we should take the girth measurement, then we come for the horizontal measurements, and then the length or the vertical measurement. Now let us see what all type of measurement comes under the girth measurement. So girth measurement includes all the round measurement or the circumference measurement, such as you can see in the picture, that the girth measurement includes the bust circumference or the chest circumference, waist circumference, hip and the neck girth. All the round measurement of the body, it comes under the girth measurement, and that should be taken first in the process of measurement, body measurement. Second is the horizontal measurement. That includes the across back, across chest, shoulder length, across shoulder and bust span. So all these, the horizontal measurement, like when we take the measurement of the shoulder or the across back, like the back from one shoulder to another shoulder, then across chest, shoulder length, all that comes under the horizontal measurement. Third process or the step is the vertical measurement, in which we take the measurement for the front length, center front length, center back length, shoulder, high shoulder point to bust point, and armhole depth. All these measurements are taken under the vertical measurement. Then there are two types of body measurements we take. First is those that are actual point on the body measurement. Actual point, that is the length and the width, and those are the horizontal circumference around the body. Both of these types, the actual measurement or the horizontal and the circumference measurement, we need both these types of measurement for the construction of the pattern, development of the pattern and construction of the garment. So all these points, the guidelines, the process and the types of measurement you have to keep in mind when you are going to take the measurements. And there are different body landmarks you have to understand, which is very important when you are taking the measurement of the body. Then in the picture, also in your study material, your picture is provided that you can see that there are different landmarks, total 17 landmarks it is given on the body, that is we need to take the measurement for every type of the garment, such as we have the armholes, back neck depth, front neck, shoulder, cap sleeve length. All these measurements we have to take under the body landmark. Then one important topic of this particular unit is size chart. So size chart is very important, because when we develop a pattern, so for every garment, or if we have developed a pattern of one particular size, so we cannot develop a different pattern or of number of sizes. So in that case we use the size chart so that we can manipulate that particular pattern to have different sizes from one particular pattern. So size chart, to get the size chart, how it is developed in industry, to get the size chart, sample population is measured to get a trustworthy data. So when to develop a size chart, the designers or the manufacturers, what they do, they take a survey or they take a particular population or number of people, they take the body measurement of each and one, and on the basis of that particular data, they develop one standard measurement. Like when we go to buy any garment of any brand, we see that there are number of sizes like small, medium, large, 30, 34, 36. So all that is based, or that they have created from a particular sample size or with a survey. So that they have developed, and it is basically done for the ready-made garments are produced for the mass that fall in different sizes. Like we cannot, being a manufacturer or a designer, we do not have to develop a garment of only one size. We have to develop for the n number of sizes. So all for that we have to prepare the size chart. A sizing system is based on body measurement and taken on a cross section of population. So it is taken from the sample from the population. On the basis of that, the size chart is developed, and on the basis of that we develop the standard patterns. Then the study of the sample population helps manufacturer to produce garment which provide a good fit for a large number of customers. It also gives an effective sizing system, must cover the largest number of people with the smallest number of sizes. Like from the maximum to the minimum, we have all the number of sizes. So different country uses different size intervals. Like right now we discussed some brands, they have different sizes in numbers like 10, 12, 14, 16, and some brands they have in the alphabets like small, medium, large, extra large. All that is based on the different brands to brands. So this is the basic idea of size chart. And now why it is important, what is importance of the size chart? So proper sizing is very important to the ready to wear garments. So if we are buying a ready-made garment, if the fitting is not good or it is not of our size, we will not purchase that particular garment. So proper sizing is very important to the ready-to-wear garments as industry because of the following reasons. Like it allow the manufacturer to produce garment which can fit the maximum number of people. This will help the retailer to stake a suitable range of sizes in each style and thus cater his market. And with proper size range, the customer is at an advantage as this increases the chance of finding garment in a size and a style. So if we manufacturer have different sizes of a particular design, it invites customer or they have lot of customer interest to buy from their particular brand. So this is the importance of the size chart. So all these topics are being covered in the unit 3 body measurement that in detail you can study from your study material. Then the unit 4, that is the last unit of this particular block, is pattern information and marking. So it is very important because in the first unit we have studied about developing a pattern. We know about different tools of pattern making. We know about right now we discussed about taking body measurement. So then the next unit or the topic is, if we know and we have developed the pattern, then it is very important. So being a designer or being a student of design, that we should know the technical terms or the differences between the what all information we have to write on the pattern. So this unit will deal about the professional language of the pattern. So we hope that after going through this unit you will be able to recognize and illustrate pattern information, identify and measure different ease amounts, and you will be able to demonstrate production pattern making and the markings. All these are basic learning outcome of this particular unit. So first term or the first topic which is discussed in this particular unit is or the information which we have on the pattern is the seam allowance. Seam allowance are the margin given around the working pattern. So pattern which we have developed, there is a certain amount or seam allowance is given. Like in the body measurement part, we said that we do not have to add any extra ease or margin when we are taking the measurement. That we will do in the pattern development part. That this seam allowance is the part of that particular adding the extra ease or the allowance. So seam allowance are the margin given around the working pattern. This will help you to hold 2 layers of the fabric together and stitch. Seam allowance are made by drawing the set measurements on the outline of the pattern, and amount of seam allowance varies from straight area to the curve area. Like when we develop the pattern, or you will be developing a pattern, you will experience this particular while you will doing the hands-on, that the seam allowance, it differs from the straight area of the pattern to the curve area. So we have different amount of ease to provide, or the seam allowance we have to provide according to the type or the pattern we are developing. Then this is the image how the seam allowance, the extra line apart from the pattern which you see, it is the allowance which is given on the pattern. Then truing of the seam allowance. Next important topic is it is truing of seam allowance. So seam allowance once drawn need to be trued. Means that if what the margin or the allowance which we have given, it needs to be improvised. So truing is important at the beginning and end of the side seam and the shoulder seam. To true a side seam, fold the seam allowance to the garment and run tracing wheel at the armhole curve. Once the final pattern are made, it is not necessary to have the stitching line marked on the on it. Like if we have trued the seam allowance, it is not necessary on the pattern that we will have the marking of the stitching line. So moreover, in production it is not possible to mark the seam lines. On all the layers of the cutting marking, notches are commonly handy. So it is not possible to make the seam allowance or the cutting or the stitching line on every layers of the fabric. So one of the marking we do, it is the notches or the notching. That is, it is one of the symbol that it means the person who is going to construct, they understand that from this particular point we have to cut or we have to stitch the fabric. So this is about the truing of seam allowance. Then next is pattern information, which is very important to understand when you have developed the pattern and you have forwarded that pattern to the production department and they are going to use that pattern for stitching. So there are certain informations which is given. There are two types of informations we write, two ways. That first is the written information, that it is like the name of the garment, name of the pattern pieces, sizes, like it is of which size the pattern is, center front and center back, style number, code number, number of pieces to be cut. All these information are written in the written form. Then the second is the marking and symbols. Like some informations we do not write, we use the symbol or the marking for that, like size selection line, cutting line, like dotted line are said as the cutting line, sewing line, arrow, bust point, cut and fold. All these comes under the symbols and the markings. Then one important thing to understand is the specification sheet. So specification sheet, it is a documentation sheet including all the design details and the specific stitching details of the minutest area. So all that in the picture you can see, this is how the specification sheet looks like. So it contains all the information, and if we forward this sheet to the production department, they understand what they have to do. So learners, in this particular session we discussed about the unit 3 body measurement and unit 4 the pattern information and marking. In detail you can study in your study material. So briefly we have discussed all the topics. In detail you can study in your study material, and if you feel any query or any difficulty, you can write us on cfde@ignou.ac.in. We will be happy to answer all your queries. Thank you.
Do you wish to be part of a television studio like this, or any other media system, or already part of any media system, want to enhance a new set of skills? Welcome to School of Journalism and New Media Studies. Here in the School of Journalism and New Media Studies, we are offering program for all set of people to learn and enhance their media skills. The vision of School of Journalism and New Media Studies is to generate a new set of professionals in the area of media and communication studies with understanding about role of media in the national development and global understanding. We offer innovative programs in the field of journalism and mass communication that sets the benchmark of high quality learning and teaching process at the national level. We offer these programs across the country with the help of our regional network as well as study center. Same manner, many of our programs are offered through online mode with a sophisticated learning management system. SOJNMS offers programs from PhD in journalism and mass communication till certificate level. We have Masters in Journalism and Mass Communication. The eligibility is Bachelor's degree. And we are introducing this program in 3 languages, Hindi, Tamil and English. Students from national and international students can join either through online mode as well as in the distance mode. We have 4 postgraduate diploma programs, specialized areas in the field of development communication, digital media, electronic media and journalism and mass communication program. And all these 4 programs are available in distance mode. 2 programs are available in online mode, development communication and digital media. And we have specialized certificate program in community radio. Ignou employs various media and communication tools for better teaching and learning process. School of Journalism and New Media Studies utilizes this media system for delivering all our programs. Come and join with us for exploring a new career and enhance your media skills.
हेलो लर्नर्स, आज हम लोग राग देश और राग भूपाली के बारे में जानकारी लेंगे। सबसे पहले हम बात करते हैं राग देश की। ये राग जो है आपके फर्स्ट ईयर की 2nd सेमेस्टर में आपको ये राग सीखना है। राग देश जो है ये एक बहुत ही जाना पहचाना जो है धुन है जो आप बचपन से सुनते आ रहे हो। सबसे पहले सुबह उठ के जब रेडियो में वो बजता है तो उसी से सुबह होती है और हम लोग प्रेयर में भी स्कूल में गाते रहे हैं। वो है हमारा राष्ट्रगीत। आपने सुना ही होगा वंदे मातरम। तो वंदे मातरम जब हम गाते हैं तो ये राग जो है राग देश पर ही आधारित है। तो मोटा मोटी आप लोगों को राग देश का जो चलन है, जो उसको जब स्वरों में पिरोया जाता है वो किस तरीके से चलता है, इसके बारे में आपको न जानते हुए भी एक धारणा सी बन गई होगी। देखिए मैं गाती हूँ, वंदे मातरम वंदे मातरम सुजलाम सुफलाम मलयज शीतलाम। ये जो तरीका है, ये जो उठना और फिर अवरोह होना, आरोह में जाना और अवरोह में आना, ये जो तरीका हमने लिया वंदे मातरम का, इनको हमने शब्दों में पिरोया। और अगर हम स्वरों से गाते तो नी सा रे मा पा नी सा रे नी दा पा ध म ग रे प म ग रे गा सा। इस तरीके से ये जो है राग चलता है। राग का आरोह अवरोह ही ऑलमोस्ट आपके वंदे मातरम जो शब्द बोला गया है शुरू में उसी में आ गया। तो पहले हम देख ले कि राग देश जो है वो किस थाट का राग है। आप तो जानते ही हैं कि हमारे जो राग हैं उनको वर्गीकृत किया गया है 10 थाटों के अंतर्गत। यानी थाट क्या है? जो स्केल है, जो कि गाए नहीं जाते, लेकिन वहां से हमको उस स्केल से हमें कई रागों की उत्पत्ति होते हुए दिखती है। ठीक है, तो ये जो स्केल है, इस स्केल का नाम है थाट काफी, सॉरी, थाट खमाज। जी, आपने सही समझा होगा कि ये क्या हुआ कि पहले काफी बोल रहे हैं, फिर खमाज बोल रहे हैं। देखिए, राग जो देश है, इस राग में दोनों ही थाट का जो विशेष जो स्वरावली है वो प्राप्त होती है। कई लोग इसलिए इसको खमाज थाट में नाम मानते हैं और कई लोग इसको काफी थाट में मानते हैं, पर अधिकतर लोग इसको काफी थाट में ही मानते हैं। पर खमाज में क्या है? खमाज में हम जब निषाद का प्रयोग लेते हैं खमाज थाट में, उसमें सारे स्वर शुद्ध है, आरोह में जाते हुए सारे ही स्वर शुद्ध है, परंतु जब अवरोह में लेते हैं तो उसमें कोमल निषाद लगता है। इस नाते जो है इसको खमाज थाट के अंतर्गत रखा जाता है। लेकिन काफी थाट में जो है नी कोमल है। नी कोमल जो है वो अवरोह में भी नी कोमल है और आरोह में भी नी कोमल है। इसलिए राग देश को कुछ लोग कहते हैं कि नहीं, इसका जो बाकी का चलन है वो काफी थाट के मुताबिक है, तो इसलिए इसको काफी थाट में ही रखना चाहिए। तो इस प्रकार से आपने देखा सबसे पहले कि राग देश के आरोह में बाकी सभी स्वर शुद्ध हैं, केवल नी आरोह में भी शुद्ध है, और अवरोह में बाकी सभी स्वर शुद्ध हैं, केवल नी कोमल है। तो इस प्रकार से राग देश में नी कोमल अवरोह में प्रयुक्त होता है। ठीक है, अब हम देखें कि राग देश के जो स्वरावली है वो किस तरीके से चलती है। आरोह है इसका सा, रे, मा, पा, नी, सा, अर्थात आरोह इसका क्या बना? सा। सा। अच्छा, राग देश जो है वो शुरू होता है मंद्र सप्तक के शुद्ध नी से। तो नी, सा, रे, मा, पा, नी, सा, ये राग देश का आरोह है। और अवरोह कैसे है? रे, नी, धा, पा, अब नी कोमल हुआ, रे, नी, धा, पा, मा, गा, रे, गा, सा। इस प्रकार से इसका अवरोह होता है। तो आपने देखा कि सा, नी, सा, रे, मा, पा, नी, सा, आरोह में 5 स्वर लगते हैं और अवरोह में सा, नी, दा, पा, मा, गा, रे, गा, सा, अर्थात 7 स्वर लगते हैं। तो इसलिए इसको जो है औढ़ संपूर्ण राग कहा जाता है। अब इसका जो वादी स्वर है उसको अगर हम देखें तो वादी स्वर है ऋषभ और संवादी स्वर है इसका पंचम। आप हमेशा देखेंगे कि वादी और संवादी के बीच में 4 स्वरों का अमूमन जो है एक गैप रहता है, या 3 स्वरों का गैप रहता है या 4 स्वरों का गैप रहता है। अर्थात या तो वो षडज मध्यम भाव से होते हैं दूरी पर, या वो षडज पंचम भाव की दूरी पर होते हैं। तो राग देश में जो वादी स्वर है वो रे है और जो संवादी स्वर है वो प है। बाकी सभी स्वर जो है वो अनुवादी स्वर है। ठीक है, तो अब इसका चलन भी देखें। सा नि सा रे म ग रे मा पा नी दा पा धा म ग रे मा पा नी सा सा रे नी दा पा धा म ग रे ग नी सा। आप देखेंगे कि इसमें राग देश में जो है रे ग नी सा, इस प्रकार से हम षडज में जो मध्य षडज है उसमें हम बार बार वापस आते हैं। ऐसे ही जब हम ऊपर से अवरोह करते हैं तो अवरोह करते हुए हम सा नी दा पा, ये तो हम करेंगे ही, पर सा रे नी दा पा, ये जो है ये राग देश का एक विशेष जो है स्वर लगाव की एक पद्धति है। रे नी धा पा, फिर आगे धा म ग रे, ये भी इस ये जो फ्रेज है ये पंचम को परे रखते हुए लांग कर धा म ग रे, ये जो है ये राग देश में बहुत इस्तेमाल होता है। तो ये राग ये खमाज में भी इस्तेमाल होता है धमा ग रे करके। तो कई लोग, वही जो मैंने कहा कि एक कंफ्यूजन सा रहता है, कुछ लोग कहते हैं कि काफी थाट में रखा जाना चाहिए और कुछ लोग कहते हैं कि खमाज थाट में रखा जाना चाहिए। तो उसके कारण ये है, काफी थाट के लिए रे और पा स्ट्रॉन्ग होना बहुत जरूरी होता है। तो इस राग में रे और पा वाकई में बहुत ही स्ट्रॉन्ग है। आपने देखा है कि अवरोह करते समय हमें बार बार रे हम लेते हैं और पंचम में हम बहुत अच्छे से इत्मीनान से हम न्यास करते हैं, अर्थात विश्राम करते हैं। हम जितनी बार आलापचारी करेंगे हम पंचम में आके अच्छे से जो है इस पे समय लगा सकते हैं, आराम कर सकते हैं, विश्राम ले सकते हैं और फिर हम आगे बढ़ सकते हैं। आगे की आलापचारी या राग को बढ़ाने का जो सिलसिला है वो शुरू कर सकते हैं। तो इस प्रकार से ये हुआ आपका राग देश, जो आप बाद में मेरी वीडियो लेक्चर्स से इसका जो द्रुत ख्याल है, इसका जो लक्षण गीत है, ये सभी कुछ आप सीख सकेंगे। साथ ही में इसके साथ जो ताने हैं उनको भी आप सीख सकेंगे। तान और स्वरबद्ध लयबद्ध जो है आलाप, वो आप अपनी जो अभ्यास पुस्तिका दी गई है उसको साथ रखते हुए और आप आराम से सीख सकेंगे वीडियो लेसन्स के साथ। आगे बढ़ते हैं। अगला राग हम लेंगे राग भूपाली। एक ब्रेक के बाद हम आते हैं राग भूपाली पे।
Interested in television journalism or radio journalism or online journalism, or do you want to learn with the flexibility of open learning? Or if you are a working professional wants to enhance your knowledge and skill with certification in the field of electronic media, then School of Journalism and New Media Study Ignou offers PG Diploma in electronic media for you. This program includes audio and audio-visual program production for radio, television and online platforms. Here are some important details about the program. We have total 8 courses of 32 credits, 6 theory courses, 1 practical and 1 project. Eligibility: bachelor's degree in any subject, Minimum duration 1 year, maximum 3 years. Medium is English, but students can write their examinations, assignments, practical and project in Hindi also. So if you are interested in television, radio or online media, please come and join Ignou's PG Diploma in Electronic Media.
वेलकम बैक स्टूडेंट्स। अब हम लोग जो बात करेंगे वो राग भूपाली के ऊपर बात करेंगे। राग भूपाली एक बहुत ही जैसे कहते हैं लोकप्रिय राग है और सरल रागों में से एक है, ऐसा माना जाता है और शुरुआती स्तर पर बच्चों को सिखाया भी जाता है, लेकिन इसे गाना बहुत मुश्किल ही है। अगर मैं कहूँ तो आपको राग भूपाली बहुत अच्छे अच्छे उस्तादों की मिलेगी, पर ऐसे जो कम सीखे हुए लोग होते हैं वो नहीं गा पाते हैं, क्योंकि राग भूपाली एक ऐसा राग है जिसके आसपास के कुछ ऐसे राग हैं जो उसमें मिश्रित हो जाता है और उसको बहुत परिपक्वता के साथ ही संभाला जा सकता है। राग भूपाली जो मैंने सबसे पहले भी बात ही चल गई तो मैं बताऊं कि इसकी जो समप्राकृतिक राग है, मतलब इसका जो स्वरावली है उनकी सेम स्वरावली दूसरे राग में जो लगती है वो है राग देशकार। राग भूपाली में सा रे ग प धा ये 5 स्वर लगते हैं। राग देशकार में भी सा रे ग प धा ये 5 ही स्वर लगते हैं और एकदम सीधे सीधे ही लगते हैं, कहीं वक्रता नहीं है, वक्र गति नहीं है जिससे कि हम कहें कि ये राग इस राग से मिलता जुलता नहीं है, थोड़ा बहुत तो अलग है। एक और भी राग है राग शुद्ध कल्याण। राग शुद्ध कल्याण का भी काफी हद तक जो है जो इसका जो रूप है, इसकी जो प्रकृति है वो राग भोपाली से मिलता जुलता है। इधर राग शुद्ध कल्याण जो है वो भी कल्याण थाट से उत्पत्ति है उसकी, और राग भूपाली का भी उत्पत्ति जो है वो कल्याण थाट से है। तो ये तो और भी ज्यादा मुश्किल हो जाता है, क्योंकि थाट एक होने के कारण चलन भी दोनों का एक जैसा हो जाता है। तो इसलिए राग भूपाली को शुरुआती स्तर पर तो सिखा दिया जाता है बहुत जल्दी, लेकिन इसको जब हम स्टेज में प्रस्तुतिकरण के लिए बैठते हैं, परिपक्व गायक के रूप में, गायिका के रूप में हम बैठते हैं, तो हमें दिक्कत आती है कि राग का रूप जो है वो हम सटीक बना के रखें। राग भूपाली 5 स्वरों का राग है, इसलिए इसका जाति क्या हुआ, इसकी जाति है औडव जाति, यानी आते हुए भी 5 स्वर हैं और जाते हुए भी 5 स्वर है। आरोह में भी 5 स्वर हैं, अवरोह में भी 5 स्वर हैं। इसका थाट जैसा कि मैंने कहा कि ये कल्याण थाट का राग है। और अब इसकी जो वादी स्वर क्या है, इसका वादी स्वर है गंधार और संवादी स्वर है धैवत। अब वादी स्वर जब गंधार है तो आप समझ रहे हो कि राग के पूर्वांग में एकदम शुरुआत की तरफ ही आपका वादी स्वर रखा हुआ है, अर्थात ये राग अधिकतर नीचे ही खिलता है, या ऊपर भी जो पहला टेट्राकॉर्ड है, जो पहला अंग है, अगर हम तार सप्तक में जाते हैं तो ऊपर भी सारे गा तक ही ये इसका विन्यास होगा, इसकी आलापचारिता होगी। इसको हम जब खींचेंगे इसको तो यहाँ गंधार तक ही जाएंगे, इससे ज़्यादा नहीं। जब किसी की आवाज़ जाती है वो पंचम तक जाता तो है, परंतु इस राग में मैंने जैसे कहा कि जो इसका पूर्वांग है वो ही बहुत इम्पोर्टेंट है, महत्वपूर्ण है। वो ही उस राग का जो है एक वो रस बनाता है और उसका वातावरण बनाता है राग का। तो इसलिए इसका जो वादी स्वर है वो है गंधार और संवादी स्वर है दैवत। अब आप देखेंगे कि इसका जो जब हम चलेंगे, हम इसकी जो चलन है वो किस प्रकार से होती है। सा रे गा रे गा पा गा रे गा प धा प गा रे गा रे सा धा सा रे गा रे गा। इस प्रकार से इसकी चलन होती है। तो आपने देखा कि हमने स्वरावलियों के अंदर बार बार गंधार को लिया, पर ऋषभ भी इसका बहुत इम्पोर्टेंट एक स्वर है, क्योंकि ऋषभ में हम बार बार आके स्वर का जो समूह है उसका अंत हम वहां पर रे पे कर रहे हैं। जैसे सा रे गा प गा रे गा प धा प गा रे गा सा रे सॉरी ग सा रे ध सा रे ग रे गा। इस प्रकार से इस राग का अधिकतर जो विस्तार है वो किया जाता है। मैंने कहा था आपको शुरू में ही कि राग देशकार जो है ये इस राग से बहुत ही मिलता जुलता एक राग है। तो वो किस प्रकार से है, उसमें भी आप देखेंगे कि सा रे गा पा धा ही लग रहा है, परंतु फिर भी हम कह रहे हैं कि वो राग अलग है। उसमें जब हम विस्तार करते हैं तो हमारा सारा जो लक्ष्य होता है वो दैवत को छूने का लक्ष्य होता है। सा रे गा प धा 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 प गा प धा धा प गा रे गा प धा प धा धा प गा रे सा रे गा प धा सा धा धा प गा प धा प धा। ये है देशकार को गाने का तरीका। तो केवल मात्र मतलब स्वरों के ऊपर अगर हम तवज्जो कम देते हैं तो ही उसका वातावरण बिल्कुल अलग हो जाता है और वो दोनों राग अलग हो जाते हैं। जैसे कि मैंने यहाँ पर बताया कि राग भूपाली में हम बार बार जो है गंधार को छूने की कोशिश करते हैं, गंधार के इर्द गिर्द हम अपना जो है विस्तार करते हैं। राग की जो विन्यास होता है, राग का जो आलापचारिता होती है, वो सब हम गंधार के इर्द गिर्द करते हैं, सारे गरे सारे गा पा गा रे, इस प्रकार से। और जब हम देशकार का विस्तार करते हैं तो हमारी यही कोशिश रहती है कि हम हर फ्रेज में ऑलमोस्ट दैवत को छू लें। तो सारे गा प धा धा प गा प धा, इस प्रकार से हमारी जो विस्तार है वो उस प्रकार से होता है। इस वजह से वो उत्तरांग प्रधान राग है और भूपाली पूर्वांग प्रधान राग है। राग भूपाली का गंधार वादी और दैवत संवादी। इसका थाट जो है वो कल्याण थाट है। और अभी मैंने आपसे कहा था कि शुद्ध कल्याण से भी ये एक बहुत मतलब मिलता है ये राग। तो वो कैसे मिलता है, इधर कल्याण अंग का होने के कारण शुद्ध कल्याण भी जो है वो नीचे की तरफ ही गाया जाता है, नीचे की तरफ ही खिलता है, पूर्वांग प्रधान राग है। तो जो देशकार में हमने देखा कि ये उत्तरांग प्रधान राग होने के कारण इसका वातावरण डिफरेंट हो रहा है। शुद्ध कल्याण और भूपाली में ये समस्या आ जाती है कि दोनों ही पूर्वांग प्रधान राग हैं, तो दोनों में ही ये प्रॉब्लम आ जाती है। परंतु शुद्ध कल्याण में एक छिपा हुआ मध्यम है, जो कि तीव्र मध्यम का जो प्रयोग है शुद्ध कल्याण में छिपे हुए तरीके से इस्तेमाल होता है। वैसे कहने को कहा जाए कि सारे गा प लगाते हैं, सारे गा प रे, ये जो हमने लिया सारे गा प रे, ये पा रे पा मगरे, ये माँ को हमने बिल्कुल छुपा के लिया है, किसी को समझ नहीं आ रहा है, लेकिन वहीं पर उसका पा का जो रंग है वो चेंज हो जाता है और वो भूपाली से अलग हो जाता है। एक और स्वर है जो हम बहुत प्रोमिनेंटली शुद्ध कल्याण में देते हैं, वो है सा सा नी दा पा रे सा, अर्थात निषाद। हम निषाद लेते हैं शुद्ध कल्याण में, जो भूपाली में बिल्कुल नहीं लिया जाता। तो कई बार क्या होता है, जब पूर्वांग में हम विस्तार करते हैं तो सा सा रे गा रे गा प गा रे, ये है भूपाली का विस्तार। और हम जब शुद्ध कल्याण का विस्तार करेंगे तो गा रे गा पा रे सा, ये हमारा जो है तरीका रहता है जब हम शुद्ध कल्याण में लेते हैं, ताकि तीव्र मध्यम की एक जो पुट है वो उसमें इस्तेमाल किया जा सके। तो ये है राग भूपाली, जो कि शाम के समय में गाया जाने वाला राग है। राग देश भी रात के समय में गाया जाने वाला राग है, रात के दूसरे प्रहर में गाया जाता है। और भूपाली जो है रात के प्रथम प्रहर में, अर्थात अभी जब सर्दियां पड़ रही हैं तो 7 बजे से हम इसको गा सकते हैं, गर्मियों में हम इसको 8 बजे से गा सकते हैं। और ये जो है रात्रि का प्रथम प्रहर का राग है, कल्याण थाट का राग है, औरव जाति का राग है, इसका वादी है गंधार, संवादी है धैवत और पूर्वांग प्रधान राग है। तो इस प्रकार से आपने आज राग देश और राग भूपाली के बारे में जानकारी हासिल की। आगे आप इसकी जो द्रुत ख्याल का जो ऑडियो वीडियो है और सरगम गीत की जो वीडियो है, उसको इस बात को, इन लक्षणों को मद्देनजर रखते हुए आप उनको आसानी से सीख पाएंगे। धन्यवाद।
Are you a fresh graduate? Do you want to fulfill your educational aspiration by pursuing higher education in various interdisciplinary and multidisciplinary areas like environmental science, environment and occupational health, philosophy, sustainability science, folklore and culture studies? If yes, the School of Interdisciplinary and Trans-Disciplinary Studies offers various programs like Master's Program, Graduate Program, Postgraduate Diploma, Certificate and Appreciation Program. The school offers 5 Master's Programs. Master of Science, Environmental Science. The eligibility criteria for MSc Environmental Science is Graduate in Science, BTech, BE, Agriculture Graduate, Forestry Graduate and Veterinary Graduate. School also offers Masters in Environment and Occupational Health, Masters in Sustainability Science, Masters in Philosophy, and Masters in Folklore and Culture Studies. The eligibility criteria for these 4 master's programs is graduate in any discipline. School also offers various socially relevant and need-based PG Diploma program like PG Diploma in Sustainability Science, PG Diploma in Environment and Occupational Health, PG Diploma in Folklore and Culture Studies, and PG Diploma in Migration and Diaspora Studies. The school also offers PG Certificate in Climate Change and Avshist Prabandhan mein Praman Patra. The school also offers 2 doctoral programs, PhD in Environmental Science and PhD in Interdisciplinary and Trans-Disciplinary Studies. The school offers various innovative technologies and multimedia for providing a very excellent student support system. The study material is of high quality. The learner support is provided through Gyan Darshan, Gyan Vani, IRC, Swayam Prabha and Swayam channel of Ignou. For more detail, please log in to Ignou website. For online admission in these programs, visit school site and also the Samarth online education portal of Ignou. So please join these programs and fulfill your educational aspiration.
Hello viewers and learners of the Postgraduate Diploma in Environmental and Occupational Health and Master of Arts in Environmental and Occupational Health. Welcome to this session. Today we will discuss on the course MEV 005, that is Occupational Health and Safety, which forms a part of your program. And to discuss on this, we have the topic as lead poisoning. And we have with us in the studio Dr. Saswati Das, who is the Assistant Professor from the Department of Biochemistry from Atal Bihari Vajpayee Institute of Medical Sciences and Dr. Ram Manohar Lohia Hospital in New Delhi. Welcome to this session, ma'am. Thank you. So, when we talk about lead, so lead may be present to some extent in our air and also in the soil in which we grow our crops, and also in the old pipes where we also get our water from. So lead is there even in the intercity environments, in the urban environments, and long ago it is seen that lead is quite toxic. And even now there are reports saying that the lead could be toxic for the human beings, especially for the children where they are showing some kind of aggressive behavior. So long ago in the Roman Empire, it has been observed by scientists that the Romans were using tremendous, that is they produced and also they used tremendous amounts of lead in the manufacturing of their pots in which they used to make the wine. Some kind of the grapes were crushed and then they were made into a syrup and then the wine was formed. And maybe the taste was given by the same lead content. In the same way, they also made their pipes and some paints and so on. So lead was really used a lot by the Romans. And in the Greenland glaciers, some of the geologists and the scientists, they studied the ice cores, and then it was found that
from the ice cores that between 500 BC and 300 AD, that the lead content was found to be 4 times more than the norm in the ancient Romans. And also the bones of these ancient Romans also were discovered, and that was also analyzed for the same. So it has been observed that this lead definitely caused a toxicity, and the ice cores of the Greenland, how the glaciers got them, this may be because of this smelting and the mining of these lead containing ores, and that has contributed to the lead in the atmosphere, which then settled onto the glaciers. So therefore lead has impacted our environment, and it has impacted the health of many of the people living here. So it is very much important for us to understand the toxicity, the toxic actions, and on what all organs this toxicity is exerted. So Dr. Saswati, the first question that I would like you to explain to our learners is that from where do we get the lead? Where are the sources of the lead into maybe the food sources and so on? And also if you could shed light on the permissible limits of the lead in the food and the food containing products.
Thank you, Dr. Sushmitha. Good afternoon, learners. So as Dr. Sushmitha was describing, there are various sources of lead in the environment. One of the major sources in our part of the world is coming from the food. Then it comes from the lead-based paints that we have. It is there in the soil content. Previously, there used to be a form of petroleum that we used, which was known as gasoline. So it had a very high lead content. So that is to lead to a lot of poisoning. There are certain industries which produce lead, like the automobile industry, the battery recycling and manufacturing industry. So these are some of the major occupational exposure of lead. And as Dr. Sushmitha was asking me, what are the permissible limits of lead? So for in the food content, for children specifically, as they are the most vulnerable population for lead poisoning, the amount that is recommended is 2.2 microgram per day. And for pregnant women, it is 8.8 microgram per day. Pregnant women, it's very important to measure the lead content in them, because there is a developing fetus which is growing in the mother, and lead is something which causes to the placental barrier, and it may cause developmental delays in the fetus. So I will start with my lecture today. So the learning objectives for all of you learners is to define what is lead poisoning, what are the sources of lead, how do you identify, how do you recognize the symptoms of and the health effects of lead, what are the vulnerable populations, what are the signs and symptoms, how do you describe the prevention strategies, and discuss the treatment and intervention. So what is lead poisoning? Lead, as you know, is a heavy metal. Lead is soft, malleable, ductile, and it has less corrosive properties. That is why it is used extensively. So lead poisoning, it occurs when lead accumulates in the body. When does this happen? Due to the exposure to lead-based products in an environment which has a high lead content. What are the sources of lead? So as I was telling you earlier, the major sources of lead are dust, paint, soil, food products, and then some are present in the home remedies that are used, the traditional medicines that are used, cosmetics that are used. There is something known as endogenous exposure. What is endogenous exposure? It is when somebody accumulates lead for a long period of time. It is stored in the tissues. So there it leads to a chronic symptoms of lead poisoning. Then drinking water contaminated by lead pipes is one of the major causes of lead toxicity. So how do we get exposed to the lead? We can swallow lead dust. There is a process known as sanding. So when you remove lead-based paints from the walls, you can get exposed to the lead dust. You can inhale the contaminated air which is contaminated with the lead dust. Then you can have jewelry, cosmetic products which contain lead. There can be paint chips that you can inhale while removing a lead-based paint. Then the children are at the highest risk of inhalation of lead-based paint, and pregnant women with a developing fetus is highest at the risk of exposure, as she can pass on the lead to the fetus that is growing within her. So we can now discuss the health effects of lead. Lead is a metal which can deposit in all the systems of the body. So some of the major effects of lead are anemia, kidney damage, developmental issues in children, irritability, cognitive defects, IQ degradation in children. What are the long-term exposures? Causes: cognitive and behavioral problems. So lead in drinking water, it was a major problem, and United States has been battling with this problem for a very long period, and they have brought regulations to control the lead in the drinking water. So where is this lead coming from? It can come from the lead containing pipes, the brass faucets, the fixtures, the plumbing material that is used. There is a major problem with lead is that we also tend to boil the water to get rid of any pollutants or microbial content in the water, but boiling does not get rid of the lead. So what can get rid of the lead is running cold water before use. So that helps in a little bit of reduction of the lead. Then, as I was telling you, lead is used a lot in food products. So the minimum permissible limit for children is 2.2 microgram per day, and for adults it is less than 10 microgram per day, and for women, pregnant women, it is 8.8 microgram per day. So where is this lead present in the food? So it is in the packaging, in the storage of the food, and the production lead is used. And there is a very distinct quality in lead that in certain products it will make it sweeter. As I was telling you, one of the major causes of lead toxicity is the lead in paint. It is most commonly used. Lead-based paints have been used historically in a lot of buildings, and when there is a repair work going on, there is always paint removal. When this paint removal happens, this lead can be disseminated into the air as lead particles, and we can ingest it. So it becomes very dangerous for the people who are working in the paint removal, and also if nearby there are any vulnerable population like children or pregnant mothers. So it is absolutely essential to safely remove and encapsulate the lead paint.
So just when you're talking about the lead which is present in the food products, so how do we actually know that there is lead in the food? So now you said that when you test for a product, only then you know, but how can a person be aware that, for example, I think there was something related to noodles all over globally, which had a higher lead content, and that made the noodle content also sweeter. So for a common man, for a commoner, how are we supposed to know that we are supposed to avoid these foods, or that these products contain lead, or So are there is there any mechanism for us to know about the content of lead in the food?
Yeah, so FSSAI gives a norm for lead content in the food. So all the food products that are FSSAI certified have to follow those norms. And ideally, any content of any substance present has to be written in the ingredient list that is there at the back. Because normally by consuming it, you wouldn't be knowing. But that if you follow if it is FSSAI certified in India, you will know the contents, and from the contents you will come to know, and it has to be within the permissible limits, because there is lead present all over in the environment. So there is a lead content everyone is consuming, but it has to be within the permissible limits.
Thank you.
So continuing, so as we were talking, lead is everywhere in the environment. It is in the soil because there were it could have been contaminated with the industry that was there working in that region, and then after its closure that content goes into the soil. As I was telling you, battery recycling, battery manufacture, automobiles use a lot of lead content, and lead smelting also gives a lot of lead content into the soil. So there are many small businesses like cosmetic businesses, then jewelry businesses that can also lead to increase in the lead content, and the disposal of their waste can lead to the increase in the lead content in the soil. So how do we get lead in our body? There are mainly three major mechanisms. One is ingestion, one is absorption, and one is inhalation. So what is ingestion? Ingestion, what we are ingesting, that is mainly our food products that is there in the environment, or any lead containing food that we are having. Absorption, how we are absorbing from the environment, we are absorbing, like if you wear a jewelry which is a high lead content, or if you use cosmetics which have high lead content, then you can absorb it through your skin. Inhale, because of the lead dust that you can inhale that is present in the environment, or if you are occupationally exposed, if you are in an industry that you are exposed in. So where does it, this is how we are accumulating the lead, but where does it get deposited? It gets deposited in our tissues. As I was telling you, it affects all the systems of the body. So there is a excretion mechanism in the body which will excrete the lead, but it is not, if it is, the intake is at a very high level, it cannot excrete all the lead. So then it will affect the systems in our body. So majorly it affects the reproductive system, leading to infertility. Specifically it is seen in males. Then it can affect our respiratory system. The neurological effects are profound, especially in children. There is irritability, there is decrease in the IQ, there is cognitive and behavioral defects in the children. There are birth defects in mothers who are exposed to lead. It can also lead, some cases it can also lead to cancer. Then it can also lead to endocrine system anomalies. It can lead to a decrease in the immune functions of the body. So most lead, as I told you, is excreted, and it is exchanged between the blood and the soft tissues and the other tissues of the body, and it gets deposited over time. So in young children, the absorption capacity is 4 to 5 times more than the adults. So they have been classified as the most vulnerable population for lead poisoning. Hence, it is extremely important that educators, schools that are involved in and are dealing with children become educated about this presence of lead in our environment. In adults, some of the major effects are seen in the cardiovascular system. It can increase the risk of hypertension. It can increase the risk of ischemic heart disease leading to MIs and also stroke. In pregnant women, it is very important because it can cross the placental barrier and lead to developmental delays in the child. There is no known threshold of lead. With lead, we can never say this much exposure is okay. So you might get exposed to lead for all your life, and then at the later in your life you can have the chronic effects of lead toxicity. So you cannot say this much is okay, this much exposure is okay. But how it is monitored is we can check the blood lead levels periodically to see how much is your exposure and how much is your blood lead value, so that if you are reaching that threshold, you can be removed from that environment and the lead exposure can be decreased. The developmental delays seen in children are some of the major concerns, and this is why it was flagged in children and as a major health risk. So, neurological effects of lead. On low exposure, there is attention deficits, impaired hearing, commonly seen in children who are exposed to lead. In children, the levels are at 10 microgram per deciliter. A lot of the effects are already visible. In high exposure, the children have convulsions, coma, death in some cases. Similar effects are seen in adults, but at a higher level. what are the renal effects of lead? So in the renal system, it causes nephropathy. So it is a disease which is a form of chronic interstitial nephritis, which affects the tubules of the renal system. So it causes something called Fanconi syndrome, in which phosphates are excreted in the urine, aminoaciduria is there, amino acids are excreted in the urine, and there is glycosuria, in which glucose is also excreted in the urine. So these are some of the effects that are seen. Childhood exposure can lead to the chronic renal nephritis at a later stage in life, because this gets accumulated in the renal tissue. In the blood, it's very, very important, because anemia is a very common symptom of lead poisoning, because lead is involved in the hemoglobin pathway. So the threshold for adults is 50 microgram per deciliter, and in children it can even be seen in 40 microgram per deciliter. There are two enzymes, aldehyde and ferrochelatase, that lead inhibits. So it leads to anemia. So this is an extremely important sign and symptom that we study in medicine to check for lead toxicity. As I was telling you, cardiovascular effects of lead are profound. Some of the most common are increased risk of hypertension, and this increased risk of hypertension also affects the renal system, because increased blood pressure affects the renal system as well. And also it can lead to coronary artery disease and also stroke in patients who are chronically exposed to lead. Then again, lead can cause the placental barrier. It affects the fetal viability. There are reports that there have been stillbirths in women having exposed to lead. There is child's neurological development is delayed. Sometimes the cause also cannot be identified in such children. So it may be underreported as well, the cognitive impairments happening in children due to lead poisoning.
So, Dr. Saswati, thank you for enriching our learners on this topic of lead toxicity and lead poisoning. So another thing is that we find lead everywhere in our environment. It could, as I said earlier, it is there in the air, in the urban environments, in the soil in which we grow our food, and also the lead paints. They have not been completely phased out. And of course, the lead in the gasoline, this has been taken out and phased out in many of the countries, and this is not being sold anymore. But again, we need to take more stringent action, and laws need to be enforced. And as you say, there is a lot of a problem that is seen among the children, that they have this attention deficit syndrome and aggressive behavior which is noticed, and that may be due to the foods that are containing higher content, or I would say more than the permissible limit or the prescribed limit, which may contain these harmful toxic metals and toxicants, and then that can bring about certain delayed response, for learning, and also in the case of the women who are exposed to, and even the cosmetics like the lipsticks also contain high content of lead. So that can also be one of the causes for these problems, because when we sip our coffee or the tea, and then if it is a lead containing paint which is applied to the lips, and that also could be getting into the bloodstream, and then lead can be also accumulated in the various organs and the bones of the body. So I thank you very much for this wonderful lecture, and I thank our participants and the learners of this program for your patient listening. Thank you.
Thank you.
A warm welcome to Ignou. If you are creative, if you can write well, and if you can visualize, mass communication is the correct career option for you. I am going to talk about postgraduate diploma in journalism and mass communication, which is also the first year of MA program in journalism and mass communication. So any learner who has done a postgraduate diploma in journalism and mass communication is eligible to take admission straight away into the second year of our master's program in journalism and mass communication. Duration to complete this program is minimum 1 year, and because we have this inherent flexibility in distance education system, you can take up to 3 years to complete this program. The minimum eligibility criteria for taking admission in this program is bachelor's in any discipline. To give you a glimpse of what are the various components of this program, we begin with telling you what mass communication is, what are the various areas, various branches of mass communication. Then we go on to tell you about the various reporting techniques and beats of reporting, followed by media ethics, the principles, the codes of conduct that you must follow, and we also focus on the writing skills and editing skills for print media. Now this program comprises of 8 courses of 4 credits each. 25% of the entire program is practical based. So we have 6 theory courses and 2 practical courses. This program is so designed so that it will be able to make you more employable in the market. So it helps you build a career in print media, in radio, television, new media, as well as the allied subjects of mass communication, which could be media marketing, advertising, public relations and corporate communications, event management. This can also help you become an entrepreneur in areas like photography or having your own production house and so on. So I hope that you will be excited to join this program, and we will be waiting to welcome you here in Ignou.
Hello viewers and learners of the Postgraduate Diploma in Environmental and Occupational Health and Master of Arts in Environmental and Occupational Health. Welcome to this session. So in this session, we would be discussing about the lead poisoning, part 2. This forms a part of the course MEV 005, that is Occupational Health and Safety. And to discuss this, we have an expert with us, Dr. Saswati Das, Assistant Professor from the Department of Biochemistry, Atal Bihari Vajpayee Institute of Medical Sciences, and also a Senior Specialist at Dr. Ram Manohar Lohia Hospital. Welcome to this session, ma'am. So in the first session, we discussed about the sources of lead and the from where we can actually be exposed to the lead toxicity, and also certain symptoms of lead toxicity which is observed among the people, among the human beings, and also the children are most vulnerable to this. So now, as of now, especially now if we see the lead-based gasoline products, this has been completely, it is not being sold in the markets, and as of March 2023, almost 48% of the countries have the legally binding agreements for the lead-free paints and so on, but still the lead-based paints are causing a cause of concern, and that is why the World Health Organization along with the UNEP, United Nations Environmental Program, have joined, and they have come up with the Global Alliance, and this is basically to encourage all the countries to adopt more stringent and legally binding laws and the policies for stopping the use of the lead in these paints, because off-gassing and from this paint, when the lead is being inhaled even in the indoor environment, then that causes a lot of issues. Another problem in the developing and also in the underdeveloped countries is the lead acid batteries which are being used. So the lead acid batteries, which is an informal recycling sector, and that is sometimes not recognized by the government. Then here again, the lead waste can, when it is not being done, the acid batteries containing lead, when they are not being recycled in the scientific manner, in the proper scientific technique which is not used, then that can cause a lot of contamination with lead into the soil and our environment. So therefore, we have come up with a lot of laws in 2001, and also in 2022 we have this battery waste laws which came, and after this, now we are finding that all the countries are trying to abide by these rules and policies, and we should see a certain amount of decline in these noxious and toxicants which are there in our environment and which are polluting and affecting the health of many. So continuing with this discussion, I would ask Dr. Saswati about the toxicity assessments, the toxicity tests that are being conducted for the lead poisoning among the children, among the adults, and also the various types of screening, and how is also lead being detected in the soil, and what are those factors. So if you could put light on these, I think it would be very useful for our learners.
Yeah, so continuing from our previous session, the screening for children is very important. Ideally, as per CTC norms, children are to be screened at 1 year of age and 2 years of age in areas which have which are marked for high lead content in the environment. So if when they're screened at 1 year of age and 2 year of age, if the lead levels are found to be higher in those children, or even in the high risk area, so they are to be screened regularly, routinely. And even in mothers who are pregnant, lead testing is to be done. Blood lead levels are to be done routinely in mothers. So this is very, very important. For adults who are occupationally exposed to lead, like Dr. Sushmitha was saying about lead battery recycling. So these units which handle this lead batteries, and the units which are in which are automobile industries and jewelry industries, cosmetic industries. So the workers in these industries, they are high risk. So the policy should be to identify the high risk population and screen the high risk population. So I will continue. I'll start with my next session. So we will focus mostly on how to screen for lead poisoning, how to identify lead poisoning, what are the signs and symptoms of lead poisoning, and what are the health effects of lead poisoning, and what are the treatments that are available, and how can we make policy changes which can help identify the lead toxicity in our environment. So how do you clinically evaluate lead poisoning? So there can be preventive screening. We can take a exposure history. So how do we take an exposure history? We will give some survey questionnaires to the high-risk population, specifically the ones who are occupationally handling lead. So in the lead smelting industry, or the jewelry industry, or battery recycling industry, we will identify those workers, and we will routinely screen them with the lead survey questions. So this can be one of the easiest techniques to identify people who are at high risk. Then we can do a physical examination of the patient if they exhibit certain signs and symptoms which are seen at the low toxicity levels. Then we can have a safety officer in each of the industrial units, and if any of the signs and symptoms are exhibited in the high risk individuals who are working on those industries, they can report to the safety officer. So what is involved in the preventive screening? As I was telling you, test the children at ages 1 and 2. So if they are found to be at high risk, they are to be tested annually till the age of 6. Then for the adults, there are some occupational health guidelines. So in adults, anything beyond 10 microgram per deciliter in the blood, and in children, in 5 microgram per deciliter in the blood is considered to be high blood levels. And in children, more than 10 microgram per deciliter is considered to be critical. And as I was telling you, in schools also, lead exposure risk questions can be conducted. The sessions can be conducted by the teachers, and this risk questionnaires can be filled by the students, or they can be helped by the parents to fill those risk questionnaires. Or even we can utilize our own public health system, like our ASHA workers, our Anganwadi workers, to actually screen these children for lead toxicity. Now, what is involved in the physical examination? So we would like to do a comprehensive examination, because lead is something which involves all the tissues in the body. It is deposited in a lot of tissues of the body. So a comprehensive examination, which includes the neurologic examination, the hematologic examination, meaning analyzing the blood system, cardiovascular examination, as one of the highest risks of lead poisoning is increase in hypertension, increase in risk of ischemic heart disease, increase in risk of stroke. Gastrointestinal system has to be examined, because a lot of children present with lead toxicity, and their only symptoms are vomiting and constipation. Renal system has to be examined, because it's a major cause of chronic renal failure. There are acute symptoms also, but one of the major effects is the chronic renal failure. In children, hearing and nutritional status is to be examined. Neurological examination in children has to be extensive, because we have to see the cognitive and behavioral components also. As children, we have discussed that children with lead poisoning, they become irritable, they have a decrease in IQ, they exhibit aggressive behavior. So this is one of the common symptoms that are seen in children, and it is hard to identify, as these signs and symptoms do not specifically sometimes point to lead toxicity. Hence, the screening in this case becomes very, very important. So what are the signs and symptoms of low toxicity? The patient can, or the individual or the child can present with myalgia. Myalgia meaning the patient will have complaint of pain, burning sensation in the arms. Then there will be mothers coming to us who will say they are having symptoms of mild fatigue. So in this case, what happens is that generally a history of anemia is taken. So in some cases the patients turn out to be anemic also. So what is difficult is that if it is a mother, or if it is a pregnant woman who is coming to us and is anemic, it's very difficult to distinguish whether it is anemia is due to iron deficiency anemia, or it is due to a lead toxicity anemia, because both the features of the anemia are microcytic picture of anemia. And lead is one of the metals which causes anemia, because it affects two enzymes, aldehyde and ferrochelatase, and it can lead to a picture which is similar to the iron deficiency anemia. So it is very, very important we do a capacity building in our institutions which are capable of detecting the lead levels in individual. Then one of the most common symptoms specifically seen in children is irritability. The child will have try to exhibit a aggressive behavior, will be irritable. Specifically, these can be identified in persons who are dealing with the children, their Anganwadi workers, the teachers in the school. But these are generalized symptoms. So for the teachers to identify, it is important that the specific questions are asked to the children. That is the risk question for lead toxicity. It is very, very important, because irritability can be due to a lot of other reasons also. Child can be lethargic. A lethargic child there are a lot of differential diagnosis for a lethargic child. So hence, I am reiterating that screening for lead levels in children becomes very, very important. And then the child can come with, this is a very common symptoms that we see in our clinical practice also, abdominal discomfort, and it will not be consistent, it will happen occasionally. So it's very difficult to pinpoint the diagnosis with a low level of exposure. And as I said, you cannot have a threshold for lead exposure. You can be exposed to lead from a very young age, and then you can exhibit the symptoms later in your life as an adult. So this lead accumulates in the tissue, and there is endogenous exposure, and then you keep on accumulating the lead throughout your life, and it can lead to problems in an adult life. So it is absolutely important to remove the lead from the environment that you are living in, and it cannot be absolutely removed from the environment, but it has to be within the permissible limits. Then as we talked about the low toxicity, but then some people who are working in industries which are lead-based industries, or very commonly lead is used in paint, and if you are removing the paint, remodeling your house, it can be included, it can come in the environment or the air as lead dust, and children can inhale it, mothers can inhale it, family members can inhale it, or occupational workers who are coming back home with lead exposure, they can expose their families. So these people get a moderate dose of lead in their environment, and this can lead to moderate toxicity signs and symptoms, which can be, again, general fatigue can be one of the symptoms, difficulty in concentrating. Specifically, this is a very common symptoms in children. They come with this problem of difficult to concentrate in their class. There is the teacher may identify this, that the child is not able to catch up with his peers in his class. He has difficulty in catching up with the studies. So this is a very common symptoms of lead toxicity, and you can actually identify those children. They will be near an area which is high occupational exposure to lead. The mother was exposed to it, or even the mother is probably working in that industry, and during her pregnancy this lead was passed on to the child through the placental barrier. So this can be some of the challenging signs and symptoms that we see in the children, and to identify them and pinpoint them to lead toxicity is difficult. Then children or even adults can come with tremors. They can exhibit symptoms of headache. Gastrointestinal symptoms are very, very common. So they will come with a complaint of occasional diffused abdominal pain. There can be vomiting, there can be constipation, there can be weight loss. In some cases, there are patients who will come with all the signs and symptoms of anemia, and then we investigate them for anemia, and then incidentally we discovered that there is lead toxicity. So these are some of the signs and symptoms that people who are chronically exposed but to a moderate levels of lead that they exhibit. And what happens if you are constantly exposed to lead all your adult life? Then you develop severe lead toxicity. So this can be very, very harmful. It can lead to paralysis. It can lead to encephalopathy. That is, it will damage the brain, and it can lead to seizures, which can cause coma and even death. Gastrointestinal symptoms in severe lead toxicity is extremely profound. There is, as I was telling you, there can be intermittent severe abdominal cramps that can happen, and these patients can come to the hospital, but on examination, on an ultrasound or a physical examination, it cannot be identified what is the cause. So they might even get a misdiagnosis if there's a simple test of blood lead levels is not done. So it is important to screen for lead toxicity, it is important to check the patients once they are treated from the hospital. We have to review them periodically, whether in the environment the lead is reduced, whether their blood lead levels have come down. It is important to follow up with those patients. Then how do we screen for them? I was talking a lot about screening or identifying the lead content in an individual. So how do we do it? So we can do it by simply a simple blood sample. There are two different kinds of tests that can be done. One is the blood lead levels that can be done, and then there is the erythrocyte protoporphyrin levels. Erythrocyte protoporphyrin level is a very costly test and not easily available also, but and not extremely specific for this lead toxicity also, but blood lead levels can be easily done. There are point of care testing instruments that are available which can test for the blood lead levels. Then there is for confirmatory testing, then ICP-MS, which is a mass spectrometry test, which can also test for the lead content. It is very widely used and is a confirmatory testing for the lead levels that can also be done. Then there are radiological tests that we do in which we see the lead lines in the epiphysis of the bones. It's a simple X-ray that can be done and specifically very useful for the children. So a simple X-ray can be done and a trained radiologist or a trained physician can identify the lead lines. Also on physical examination, these lead lines are also visible in the gingiva of the mouth. So this is a very common examination. On clinical examination, we can identify that this child or this adult has been exposed to lead. So these are some of the common tests that we do in our hospitals. Now, coming to the standards for lead, as Dr. Sushmitha was asking me earlier also. So the CDC recommends a level of 10 microgram per deciliter as a concern for children. The normal levels that are allowed is 5 microgram per deciliter, but if it crosses 10 microgram per deciliter, the child is at high risk. And what are the workplace? Because we are talking a lot about occupational health and the occupational exposure. So when do we decide that this person is at a high risk and we need to remove him from this environment? So at 50 microgram per deciliter for removal from the job and 40 microgram per deciliter for mandatory notification. You notify the individual and you tell him that he is at high risk, and if his blood level still keeps on increasing, then you have to remove him from that environment. You have to change the environment of the person. It is something like how we check for radiation exposure. Lead is as important as that. Lead exposure is as important as that because it can lead to a lot of damage to various tissues in the body. So it is important that agencies come up with regulatory guidelines. Western part of our world has done a lot for the regulation. We have our CPCB guidelines, we have our FSSAI guidelines. So we need to come up with these guidelines and have our individuals monitored regularly for their blood lead levels. So how do we clinically manage a patient once we have identified that this patient is suffering from lead toxicity, but we want to manage this patient? So how do we manage this? First of all, suppose you identify an individual at your industry, where usually industries have a medical officer also or a safety officer also. So that person should notify the referral center, which has been identified by the industry or the regulatory body over there. Then, as you know, this individual has had lead poisoning. Then environmental investigations have to be done. So you have to check the lead content in the soil, you have to check the lead content in the air, and it has to be within the permissible limits. If it is not, steps have to be taken to keep it in the permissible limits because other people are at risk at the same time. And you have to identify whether this individual got the lead poisoning from where he was working or any other sources are there, or it is a combination of sources that is giving him this high lead content. How can this happen? Individuals have to be taught about what is lead poisoning and how can they be exposed to lead. So education about the prevention is very, very important. Now, we have identified an individual. We get a patient who has come to us, has been referred to us by the safety officer that he has lead toxicity. How would we want to treat him? Is there any treatment available? Yes, there are treatments available. There are chelation therapies which are available. Calcium disodium edetate is one of the major chelating therapy that is given, which is given intravenously, which we use very often. And penicillamine is also given orally, which is also a type of chelation therapy that we use. Then chelation therapy is a very advanced form of treatment that we use for the patients. So this has to be done in referral centers which are equipped for the chelation therapy. And this is to be done by medical practitioners who are trained in this. So this is very, very important. And from a regulatory point of view, since we are in a lead crisis in our part of the world, these treatment options should be cheap. And they should maintain the quality, and they should be cheap, and they should be easily available. We need more trained personnel, trained healthcare workers who can give this chelation therapy. Then in this way have summed up what are the signs and symptoms, how we can test for lead, and if we identify an individual with lead toxicity, how can we treat them. But how can we prevent it? If we prevent it, we stop the disease at before it has even occurred. So how do we take the preventive measures? So first is reduce the sources of lead exposure. So as gasoline is a very good example, it has been there has been lot of effort to remove it or decrease the use of gasoline. So it has reduced the lead exposure. Then you can replace the lead pipes and fixtures. You can use different material to use it. As I told you in the beginning, that lead is very less corrosive. That was the main reason why it was used in pipes and fixtures, specifically for drinking water, and it was contaminating the drinking water for a long time. But there has been a progression in our metallurgy also. So there are many other metals now which are also resistant to corrosion. So this lead pipes and fixtures can be replaced with them. Then it is very important to have a good nutritional diet with a high calcium and iron content. It is very, very important, specifically in children and in mothers, pregnant mothers. It is important that you have a diet which is rich in calcium and iron. Then you have to continue monitoring the blood levels. Screening is important in children, in pregnant mothers, even adults who are at high risk and have been identified as vulnerable population for lead exposure. Screening is very, very important. If they are screened and identified with high blood lead levels, they should be sent to the referral centers, and their blood lead levels have to be monitored regularly. Then it is important in industries which are dealing with lead to identify a safety officer. A person can be trained on lead toxicity or other environmental pollutants and has to be designated as safety officer, because that person will be referring the individuals to the healthcare professionals and help identify. Otherwise, it will be difficult to even identify patients who are coming with low toxicity or moderate toxicity. So how can we develop awareness on lead toxicity? So the major thing that we can do as even individuals is community outreach. We can reach out to schools. They can train the teachers on lead questionnaires, lead surveys. Even if the children are not able to fill the answers, their teachers can observe those children and can report to the school safety officer or the healthcare professional in that area and reach out to them and may identify that, okay, I have identified this individual as in a probable risk of lead toxicity. Would you want to screen this individual? So a communication line between the schools who are directly dealing with the children is very, very important. Then how can we reach out to the individuals, empowering the communities, reaching out to our, like in through the gram panchayats and the Anganwadi workers or the Asha workers, we can reach out to the communities. Then we can create awareness. We can run education campaigns on the effects of lead toxicity and how much lead is there in our environment or in the soil or in the food or in the cosmetics or traditional medicine that we are using. So this awareness is very, very important. So we have to envision a lead-free future, and to do that, what is important is ongoing educational activities. Everybody from all levels of healthcare, all levels of industries, our policy makers, all efforts of all are needed for a lead-free future. Lead has to be designated first as a major hazard and a health risk crisis in our part of the world. Then communities and governments and individuals have to come together and envision a future which is lead-free for the children and the mothers, specifically because they are our most highly vulnerable population who are getting exposed to lead.
Thank you, Dr. Saswati, for such a wonderful lecture on the lead poisoning, lead toxicity part 2. And this was really very beneficial for our learners and also for all of us. So in the beginning, my dear learners, our expert explained the symptoms and the toxicity of lead poisoning on the various organs and also various screening mechanisms that could be adopted in the health organizations and the health institutes. And as Madam said, that the screening is very much essential because sometimes it may result in the misdiagnosis of a specific disease, and this could be due to elevated levels of certain metals or any other compound in the human body. So thereby the blood lead levels are to be screened for, and then this may give clues as to how we need to prevent the exposure from the lead. Thereby we also touched upon the preventive measures that could be taken and all the ways how we can combat the effect of the lead in the environment and how we can use alternatives. For example, the older lead pipes, this could be replaced with the new technology which does not contain the lead-free pipe, or which contains the lead-free pipes or the lead-free paint and so on. So there have been laws, like even in the year 2022, the Ministry of Environment, Forest and Climate Change, they came up with the battery acid, that is a battery waste management rules. And so here emphasis has been put that even in the informal recycling sectors also, the battery and the lead acid batteries also should be disposed of in a very scientific manner and technique. And more, if the rules are stringent and the policy implementation is also done very well along with public participation, then we can effectively control the toxic elements and the hazardous elements being introduced into the environment, and also the health of the human beings also being affected. Thank you, ma'am, for the lecture, and I thank our learners for your patient listening. Thank you.
Thank you.
Welcome to this session. Today we are going to